Welcome to the office. Hi, Cesebel. Nice to meet you. Welcome to the office. What you doing here? What's going on?
I don't know.
You don't know? You know why you're here? Sister brought you? Mom brought you? Who brought you? Mama brought you?
Yeah. Mom.
What's going on?
Yeah.
Tell me what's going on.
So, sometimes your back hurts. Sometimes. Yeah, your bones.
Your back hurts a lot?
It's easy in my head.
Your head hurts?
No, it's easy. You get dizzy sometimes?
Oh, you get dizzy. Okay. And you get dizzy every day?
Or sometimes.
Sometimes?
How's your back feel? Is your back good, or is it sometimes? Maybe. Sometimes it's not so good.
Okay. Mom, why'd you bring her?
¿Por qué la trajo, mamá?
She's always complaining about back pain.
Low back, right?
Yeah, low back.
And in the right leg or the left leg?
Right leg, normally.
Right leg, okay. But she normally speaks a lot, right?
Yeah, but she's a little bit shy.
She's shy? I'm a little shy too. But I still got to take care of people. Okay, so there's back pain. I mean, to come here, it's bothering her. She's not just coming because she wants.
Sometimes.
Okay. And any injuries you recall? Slips, falls?
She has fallen. When she's baby, right? She fell off the couch, and
Okay.
I'm sure among other things, trampoline fell on, fractured her ankle.
Okay. Right side, left side?
I can't jump.
She broke her right side.
Right ankle.
When was that?
She was 5 years old.
5 years old. Okay, that makes more sense. All right.
I can't jump. It's too fast. You can't jump too fast?
You want to jump fast?
No.
You want to run? How about just having less back pain? Would that be cool?
Yeah.
Yeah.
You want to feel better?
Yeah.
He's going to try to help your bones, get your skeletal
I'm not going to
system
try.
nice.
We're going to figure out what the
can do it.
problem is. We're going to figure out what's causing her back pain and her neck issues. And then we're going to figure out what we need to do to help her get back to balance and have a better quality of life. Does that sound good? Sounds good? Thumbs up?
Good.
Yeah? Okay. All right, so why don't we do this then? She's not too talkative with me today, and that's okay. That's fine. No problem. Let's go over her X-rays. I want to explain. There's a lot of stuff there I need to explain, and then after the X-rays, we'll examine her, figure out where we're going to start. We'll watch her walk, and then we'll adjust her, and we'll see what happens. Sound cool? All right, let's go look at your X-rays. Come on over. This is your 24-story building. So we said in order to have a stable building, we need to have a level base and foundation. So the first thing is, do we have a level base and foundation? No, we do not. We can see we're tilted on the left side here, and we can see that the spine kind of curves to that left side. Yes? We all see that? And as it goes up, gets to the mid-back, then she curves again to the left side. So the overall effect is her body's kind of favoring to that left side. That's where she gets off balance. And the idea is, where is it starting from? So let's go into the foundation and let's see what we got going on here. A couple of things. So first thing is the base. And we can see we have a 10 millimeter MD measured difference. The left leg or the left hip is 10 millimeters or 1 centimeter lower on the left side. We have a little bit of rotation of the pelvis. We have a little bit, it's a 1 millimeter rotated sacrum, but this is one of the key findings. It's dropped 5 millimeters on the left side. Follow my process. She has what's called a PIIN ilium. Now, if I adjust her ilium, so her hip is doing this. Her left hip goes down 1, so the right is up 1. The left hip goes in, the right hip goes out. The overall effect is the body wants to go to the left side. If I adjust her hip, 10 millimeters becomes 12. So the answer is not in the hip. Whatever happened in her hip, whatever fall or slip that she did, that was later in terms of the hip, okay? 5 millimeters of this lowered leg is coming from this tailbone injury. We need to figure out how to get this MD under 7 millimeters for her adjustments to hold. And the first answer is here. We can see there's an old tailbone injury, S5 coccyx down low. If I draw a line from here, and I draw it there, and that's, you see this little lucent space here. I'll zoom in so you can see better. If we look at this is S5 coccyx. If we line that up, that matches, and that pretty much matches there too. So she had an old tailbone injury. Let's zoom in and let's look at the tailbone. We also have a bad base posterior sacrum. I will explain that in a second. When we look at the coccyx, it's a little subtle. The X-ray is a little fuzzy, but we have a little bit of an opening in the coccyx. So we need to figure out this S5 coccyx. Why is that so important? The spinal cord ends at L1. It ends about here. It becomes a string and it goes down and it inserts into the tip of the coccyx. When the coccyx misaligns forward, it causes a loosening of the spinal cord. The tone is loose. When it misaligns back, it's tense, tight. Okay? Her scenario, it's opened a little bit it's gone forward. So the overall tone of her nervous system is a little bit on the looser end. Okay? So that's number one. Número dos, mira. She had an old fracture here of her sacrum. And this is called the base posterior sacrum.
Like a dog.
What's that?
A dog.
Like a dog tail.
Yeah, like a dog tail almost, right? And if we
Like
look
an
at this,
animal.
this is an old
Human
injury.
body, a dog.
This is over 20, 25 years old. How old are you right now?
No, it's my dog.
How old are you? How old are you?
I don't know.
You don't know? Well, this injury is 20, 25 years old. This is an old injury. Yes, ma'am. She was a baby. That's what I'm saying. So that's number one, okay? Number one is we have to figure out this low back. She has a coccyx S5 issue and she has the base posterior sacrum. There's two separate issues in her tailbone. That's where we have to start. From there, I want you to see the lowered leg and all that caused this spine to curve to the left side, okay? It comes back to neutral, and then again, she had something happen here. This is 1, 2, T3, T4. T3 is a hard side slip. Something happened where there was a blunt trauma from left to right side here at T3. You see this bone right here, ma'am? That's not from posture, I'm sorry. So whatever happened there, we're gonna need. Now, as we go up the spine, whatever's going on up in her neck here, this is all compensation. I need you to see this, ma'am. All of this neck is kinking and compensating for this, and this is compensating for the foundation here. So her majors that I'm seeing right now are going to be her tailbone and her T3. Those are the majors that I see that stand out. Whatever I find on her is what we're going to work on, though. It's not, I'm not treating the X-ray, I'm treating her, okay? Now, digestion is a little bit off. Her digestion, we look at the Megan-Blasi there, the gastric air bubble is small. We have some undigested food going through, producing a little bit of gas there. Someone got gas?
No.
No gas?
It hurt.
I'm sorry. Okay. Let's go over this X-ray. On this X-ray, and by the way, there's a lot of
It's
good...
like a brain.
What?
The skull.
That's your skull.
There's a
Your-
brain.
Yeah, your brain is in there. That's right. This is your side profile. This is how you look like from the side. And by the way, there's good news I'm going to go over at the end. That's not what you came for, but there's good news as well, okay? Yeah. So, first thing is, let's look at your curves. You have a decent curve in your low back. You have a decent curve here, and you have a decent curve here. This should be a 60 degree, 60, and 40 to 60. Her curves are actually fine. That's her blessing, okay? Now, her posture, on the other hand, let's look at the posture. We run a posture line up, and let's see. And
Ears.
well, no, this is good too, because look, the lowest lumbar matches with the lower part of the neck in C2. So her posture for what she has or what she's compensated very, very well. Now, here's a very, very important lesson I want to teach you guys and these guys out there. When we're looking at both these x-rays, okay, the thing that has saved her all these years is her lateral curves. So when we look at both x-rays, if we have the right curves here, then whatever is going on here, the body has been dealing with, and then she's been dealing with it. But if we have the wrong curves here with this, that's a more miserable situation. If we have the wrong curve here, and this is perfectly straight, that's also not good. So the good news is her curvature on this x-ray is good. She is compensated. It's going to feel a little weird when I start with her. Her discs, this is the thin one, L5. L4 is thinning out a little bit, 3 a little bit. These discs are all good, okay? These discs are all good. These discs are all good. When we get to the neck and we look at the discs are good. The discs are all... It looks a little bent at 3. 3 looks posterior a little bit, but overall it looks good, the neck, okay? So what's the take-home message? Whatever's going on up here, it's starting from T3, and all of this is a result of her foundational imbalance. Does that make sense, guys? Any questions in what I went over? See, you ready to get started now? Now the fun stuff. All right, so let's go ahead. I'm going to run the meter on your back, starting at the base of the neck. Let's see what we find. All right, so I went back to the old setup, guys, back in the upstairs office. And Cesebel is going to be our first video and back in this old setup. T3. T3, 6 points.
Wow.
Hi. How's it going? S5 Coccyx, T3. There it is. All right. Let's go ahead and feel what's going on. And what I'm going to do is come back slowly towards me. That's 5. Does that hurt when I push there?
Does that hurt? You can tell me.
This one or this one? That's 2.
That one.
That's 3.
That one.
That's 4. That's 5. That's Coccyx. That's L5. Diggy diggy. That's L5. I got it. I'm sorry. That's 1. That's 2. That's 3. That's 4. Come back slowly. Back. That's 5. And that's Coccyx. It's starting in the Coccyx there. Okay. Now, let's go ahead and do static palpation. Head down, please. Head down. There we go. 1. 1, 2. That's 3. That's 4. Does it hurt more when I push at 4 or 3?
Which number hurts more?
Number 3? No. Number 4. That's 2. That's 3. That's 4. I feel 3.
Does 3 hurt or 4 hurt?
That one or that one? That one right there. It's actually starting at 4. So we'll do 4 and coccyx today. Now, we get to watch you walk. Stand up for me, please. Stand up. Come stand over here, please. And what we're going to do is we're going to watch you walk. Come stand right over here. Right over here. Turn around. Good stuff. And one of you go over on that side over there so she can give you a high five. And we're going to watch her normal walk. And go ahead and go give Sis a high five. Go walk over towards her. Go, walk. Turn around. Come walk towards me here. Turn around. And walk one more time. Keep going further back. Walk. So she walks, her dimples move, but she's very unstable. She goes side to side when she walks, right? Okay, come over here. Come back in the chair. Let's have a game plan. Come sit over here, please. So here's our game plan for today. We're going to go on the Hylo table today. We're going to do the coccyx, the tailbone, and we're going to do her T4. After that, we're going to watch her walk. I'm going to recheck. Then I'm going to tune up her feet and her shoulders today. Sound good? ¿Lista?
No sé español.
Sí, poquito español.
English.
Okay, are you ready? Come on. Go face down, lay down. And once it goes down, you'll slide up, okay? Put your hands right here for right now. I'm going to be on the outside. Nice and easy there. You got her? That's the home run.
You got it.
Gotcha.
Good job.
Good job, nena.
Good job.
Está arreglando sus huesos, mija.
Sí. One more. All right. Now for T4, PRI. T4. Slightly on the transverse on the left. Perfect.
Relax.
That's it. Done.
How about my nose?
You're doing good.
You got your nose? You're all set?
You saw that?
Okay. I'll have you come back over here, please. I'm going to raise you up now, okay? Hold on. Bring your feet together. Slide down, down. Watch your feet. All right. You survived. Give me your hand. Good job. Give me your hand, please. Give me this hand. Okay, come off. And let's walk. Let's walk. Now you're going to walk this way, back and forth a couple of times. Walk. Turn around towards me. Keep walking. Oh, you fancy like that now, huh? Turn around. Keep walking. Turn around. Walk faster towards me. What do you think, Mama? A little different? She's a tough customer, guys. Walk one more time. Check it out. Very cool. Come back over here. Come back over here and have a seat. There you go. Have a seat right there. And let's retest. Good job. She's a tough customer. Upper back is clear. Low back is clear. Let's look at her face. Come back slowly. Mira, come back. Don't be scared. Okay, come back. Come back. Come on. Come back. Okay, one more time. Put your hands here. Lean back towards me, please. Lean back. Lean back. That's 5. That's 5. That's 1. That's 2. That's 3. That's 4. That's 5. That's the tailbone I did. Different? Feel a little better? No?
No.
You ready now?
You ready now? Okay. Now I gotta do your shoulders. I'm gonna reach over here, okay? I'm gonna hold your elbow, just like that. That's it. I'm gonna hold your elbow, just like that. Last thing I need to do, I want you to lie back. Lie on your back here.
Put your head on that.
Put your head here. Okay, I'm gonna work on your ankles. The sound is the board, okay? It's gonna sound really loud like this, watch.
Oh.
It's gonna sound like that. And left side. There you go. Okay, come on up, let's walk it out. Come on up. 1, 2, 3. Turn. And walk one more time to the corner over there. Okay, walk towards me here. It hurts? Walk one more time, please. She's not used to it. Okay. Come back over here and have a seat. Now we got to do the buff and polish. Have a seat.
She's trying to walk like a robot. That's what she said.
Have a seat. She's fun. Now vibration. Feel good. You got your hands full here.
Must be feeling better if she's trying to do a catwalk.
She's trying to do
like
the RoboCop. The RoboCop. That was a dance from the 80s. And no, I'm not doing the RoboCop. You're all set, okay? That's where we're going to start. It was a pleasure to meet you. And I'm going to see you for a couple of visits, okay? I started in her tailbone. And I'm hoping 1 or 2 adjustments there, then we can move up. Okay, Mom, you have any questions? You good?
No.
You have any questions? Welcome to the office. Nice to meet you.